I'm Dr. Brenda Fitzgerald, Chair of Resilient Georgia. Because of COVID-19, countless Georgians have faced decreased access to behavioral and physical health care, and they faced increased concern about food, housing, and financial stability. And COVID-19 has drastically changed the way we're educating our children. To help Georgians cope with these challenges, we have launched with multiple partners the Mental Fitness for Resilience campaign. Our partners include the Schools of Medicine at Augusta, Emory, Mercer, and Morehouse University, Children's Healthcare of Atlanta, Chris 180, Georgia School Health Alliance, the Center for Victims of Torture, and the Georgia Alliance of Therapeutic Services. The initiative is working to build access to critical prevention and support systems that at-risk individuals Georgians need as we continue this public health crisis. We are so pleased to be partnering with Georgia Public Broadcasting today and pleased to bring you subject matter experts that will share their knowledge with you about coping skills in uncertain times and about how to build resilience for yourself and for your families. I'd be pleased to introduce our panel. First, Dr. Sarah Vinson. She's a triple board certified child adult and forensic psychiatrist. She's the associate professor of psychiatry at the Morehouse School of Medicine. Dr. Caitlin Dooley is deputy superintendent in the Georgia Department of Education. Kathy Colbinson is a licensed marriage and family therapist, and she's president and CEO of Chris 180. And Dr. Andrea Meyer Stinson is a licensed marriage and family therapist who is also a professor of psychiatry at Mercer University School of Medicine and the current president of the Georgia Association of Marriage and Family Therapists. Dr. Benson, I'd like you to start first. We know that this is a physical disease. So the first questions we've heard have been about that. And the question is, my neighbors have been hit hard by the virus. I'm scared it's only a matter of time before it affects my household. How do I cope with this fear so that it does not dominate my day? Dr. Benson.
Yes. And so one of the things that I've talked to families, parents, children, and my adult patients about, frankly, is taking control of the things that you do have control over and limiting your exposure to things about COVID, both when it comes to the exposure to the virus and exposure to things like excessive news coverage. So take in enough information to make decisions for your family and to know what your next steps are, but there's very limited return to spending hours and hours sort of reading about it or hearing about it. Focus on what's in front of you, which is always good for mindfulness purposes anyways, and do what you can where you are with what you have to limit your exposure and to reclaim the parts of your life that are still in your control, because there are things that we can all do that sound simple but that are really important, like making sure you're getting your rest, incorporating movement into your life, and staying connected to the people that care about you, who you care about, the best way you can.
Good advice. Dr. Culbertson, the next question is for you. My days are blurring together, and I'm having a hard time adjusting to personal time, family time, and work obligations being in one location. Is there something I can do to make this transition easier?
The first thing that I think is really important is to acknowledge how you feel, where you are. The reality of the situation we're in is that it's fraught with uncertainty, and we have lost our normal structure. We've lost the things that orient us, the activities, the schedule, and we're having to create our own schedules. And that's what we can really do. We have lost our markers, so we need to create for ourselves new markers, new guideposts of how we're going to operate in our homes and our families. We can create a structure. We can ask questions of our family members about what would work for them, for their routine, when there's schoolwork to do and their chores to do and their other pressures that we have. It's really important now to take control of what we can control, as Dr. Benson said, and be able to build our own routine and our own structure. And when we take control of the things we can control, it helps us and focus on in the moment and be able to talk to our kids, talk to our families, experiment with what is the routine we can create. It's not very often we get to create our own schedules and routines. But doing that and getting input from the family members, the children and the adults in the family, and recognizing what your limitations are in terms of space, with the number of people in your household, and figuring it out together. It's an opportunity to build a connection and understanding and have compassion for the different feelings of the different people that you're living with.
Thank you. Dr. Meyer, this question's for you. I feel extremely isolated now, and it seems the world has slowed to a crawl. What tips can you give to help me feel more connected?
Oh, this is a great question. I think number one, as my peers have said, to recognize that these feelings are normal, especially in these abnormal times. When we can't predict what's happening around us, we often pull in and feel alone. And it can be harmful to your physical and mental health. So this is a great opportunity for many people to build resilience, both for themselves and their family. And resilience is like a muscle. You have to use enough practice to build that muscle up, but if it's too heavy of a weight, you need to ask for help. So some things I would recommend. First, I would just rethink your expectations and practice what I call self-compassion, acceptance that this is a normal response in some really abnormal times. Then I would think about ways that you have connected with others in the past. What are some things that have fueled your mind, body, and spirit, and what recharges your batteries? I would think, how can I get those things in my life, but maybe through different ways? Staying active, doing something meaningful, connecting with others, finding comfort through different avenues in your house, lighting candles, taking baths, creating something, distracting yourself in healthy ways, and maybe even thinking about the future. And it's really hard to think about the future right now, but sometimes planning ahead can help us get out of the moment. I'd also suggest thinking outside the box and doing things that are maybe different than what you've done in the past. Making greeting cards, taking food to neighbors in a safe way, doing some classes online like Zumba, or taking some tours of museums from around the world. And finally, I would really agree with what Dr. Culberson has said, to focus on building a routine and a structure for your day. Begin with a list, be flexible, but try and remind yourself what it is you want to accomplish for that day and focus on that day right in front of you.
Thank you. One of the things that's really changed about our days has a lot to do with children. So Dr. Dooley, this one comes to you. The question is, I'm having trouble balancing my responsibilities to provide food, pay, rent, school for my kids while also being furloughed. What tips do you have to help me balance this overwhelming situation?
I would echo what other people say about being kind to yourself first, making sure that you're taking good care of yourself. It's easy to get overwhelmed with all of the responsibilities that are falling onto us right now. And I think that one of the things that we know from school leaders is that many of our school systems have moved to online learning, and not everybody has access to that. Some of our school systems have been deploying paper-based packets. Not every student has somebody at home to work with them on that. So you're not alone in that feeling of frustration. At the same time, the best thing to do for children at this time is to try to maintain some sort of schedule with them, even if it's not something that you would have done in the past, or any kind of rigorous schedule that you would have had, like as if in a school. Pulling together a family meeting and coming up with a family schedule may take some burden off of both you and the children to come up with things every moment. We have launched Georgia Home Classroom, which has public broadcasting shows as well as activities related to them, and therefore all grade levels, especially early grades through 8th grade. And so you can look at that schedule, and now is not a time to be too upset about screen time. I say this with doctors in the room, because we're all trying to get through this time right now. And just know that your children really just want you to be present. They want you to listen to them and to talk to them. And if they don't turn in an assignment, but you have a great conversation, that is well worth the time.
Very good. Dr. Culbertson, do you have anything else to add to that stressful situation of too much to do and too many places to be at one time?
Well, I think we're all saying taking control of what you can control. And so make a list of priorities for your money and for your time, because sometimes there's not enough to go around. So determine what are the actions you can take, and then set up a schedule to take those actions so that you're holding yourself accountable for taking those actions. The other thing I think is really important is to make a gratitude list. We all have things in our lives to be grateful for, even in the midst of the situation that feels overwhelming. And sometimes just taking that moment to make a gratitude list helps remind us that the world is not going to pot, that there is hope and there is a path forward. But we build resiliency through taking action and through taking steps. And so setting priorities and taking those steps is really the key. And giving ourselves a break. It's hard right now. There's an invisible enemy that we can't see and touch. And that makes it hard. So we need to give ourselves credit for the good job that we're doing.
It is hard right now. Dr. Benson, do you, as a child psychiatrist, do you have any special tips, particularly about teens who are having a hard time, but may not be willing to communicate that with their parents? Do you have any suggestions in those areas?
So when we know that people are having a hard time, it's important to not just try to get them to talk about the hard time, but to shore up the things that help them be healthy. And we know that connection with peers is important, and that things like movement can be helpful as well. And so sometimes if the child really or the teen really doesn't want to talk about it, less might be more, and sort of bugging them to talk about it is not going to have the desired effect that you want, and you're stuck in the house with them. So I wouldn't take that approach. But as some of the other panelists mentioned, just being present, taking a walk together, playing a board game, because it's really easy, even though everybody's in the home, to do things in parallel and still not do things together or that are interactive. And so making it a point to do things that are interactive, and COVID doesn't have to be the topic, but just giving them a chance to discuss with you, and in so doing, some of these other things may bubble up. And just to echo the point about screen time, the advice that I'm giving people is if they would normally connect with their friends in person or normally go to school in person, we're not counting that against their screen time cap. We want them to stay connected because it's going to be really important now.
Okay, thank you. Dr. Dooley, any comment maybe on, do you think we know when the change in education may occur and we may return to more traditional classes? And when you're looking at that, do you think there's anything we're learning now that once we move past this time of flattening the curve, it might actually be better for us?
Yes, I think this time is going to be one of those moments in our lives where we think before and after. As we look toward the next school year, we really don't know what's going to happen yet. We are still writing a guide at the Department of Education, but we do hear from school districts coming up with different plans. One of the things that gives me hope is that we have seen the dissemination of devices and connectivity happen, and it is now possible, primarily because of policy changes. It's now possible for school systems to help support home computer access and home broadband access. We have a tremendous gap that we call the homework gap. This was affecting student learning well before this disease came through. And if we can close that gap now, that will be a tremendous service to many students who need access to the internet in order to complete just general assignments. We have seen online learning hit a new height. I would not call this typical online learning. I think this is crisis learning. For the most part, what we've been advocating is for, as schools try to do remote learning, whether in print or in online, it really is to continue to have the connection that a learning community creates. And I think that there's a newfound appreciation for teachers and the connection that they create with their students during the day that supports them throughout the day, not only as learners, but also as young people who are growing up. Childhood is a really hard time. It's just a hard time for people as they become adults. So teachers have a special part in all children's growth and knowledge. And lots of times that happens in a face-to-face environment. And we're seeing how a community of learners can continue online. Another thing that we're seeing is the tremendous appreciation for all of the other support systems that a school system provides. So for example, many of our school systems are providing meals at a rate that is significantly important for an entire community. And we're in the midst of trying to increase that access during the summer so that it provides meals for that family. And then finally, I do think that we have a better understanding of the significance of social and emotional health in order to support learning. As I mentioned, I think of this as crisis learning. It really is an opportunity to maintain significant routines and schedules and connections. It's not the best environment for academic learning because we need to have a situation for academic learning to be profitable and helpful. We need to have a situation where people aren't feeling like they're in crisis. They need to feel emotionally secure and socially secure. And I think this will help us understand better how that occurs in the brain so that we can be better at facilitating learning.
I like that. How about the rest of you? Can you tell me what you're seeing in your communities? Are you seeing particular instances of people turning this challenging time into a time to help others or a time to do things a better and new way? And I'll just like to open this up and see who'd like to take it.
I'll say in academia, we're definitely having adoption of technology at a faster rate than I have ever experienced. Academia can be hard to push forward. It's like turning a cruise ship to get anything done. And it has been remarkable the way we've been able to pivot and make these things happen. And I do think it's going to make us more nimble and more efficient in a lot of ways moving forward.
That sounds good.
I'd like to take a minute to talk about parenting.
Mm-hmm.
I think that one of the key ingredients in resilience for children is the relationship with their parents and their caregivers. And what I've seen is that people have started to focus back on what it really means to have strong relationships in the home, to show affection, to provide a sense of security and safety, and to learn more about your children and how to manage their emotions. And there's so many more resources out there now helping parents to navigate that. It's certainly a difficult time for parents. As a parent of 4 children and working, it's just really hard. But we also know that if we spend more time one-on-one with our kids and use more positive feedback with them as much as possible and play with them and just talk with them and communicate with them, this is a huge opportunity to build those relationships into strong, resilient relationships between parents and children.
Yeah, I think the 2 family therapists here, we're going to say the same thing. That is something that we're seeing is there's an opportunity here to get to know the members of your family in a different way, in a deeper way, by asking questions, by finding out what's important, by doing projects together. And that's part of what I'm seeing in some of the families is there opportunities now to take a walk together, to play cards, to be able to build a garden. Somebody in my neighborhood told me he built a garden with his two daughters. And so
Love it.
we have those opportunities now in a way that we didn't have them before because we were so busy.
Right. We certainly have more at-home time. Thank you all for your comments. Are there any last, I'm going to go around and ask you one at a time. Are there any last thoughts you'd like to give our listeners? Dr. Meyer, let's start with you.
Yeah, I would say, resilience can be built during this time, even though it's a stressful time, depending on your situation. You can also think of this as a time to build that muscle of resilience in yourself and in your families. At the same time, if the weight of your stress is too much, ask for help and get resources, because you can't build that resilience muscle if you're overwhelmed with the stressors in your life, in your home, and in yourself. So ask for help, and hopefully we can help push some resources your way through this event.
Thank you. Dr. Dooley.
Well, I just hope that we use this time to really reevaluate what our priorities are. We've seen that we're all in the same storm, but we're not all in the same boat. We've experienced that a lot in schools where we have significant needs that the schools support in families. And I hope that we will take some time to really evaluate where our priorities are and how we can help children and their families. One of the things that I've seen work, and we've been trying to get this in place in schools, is telehealth. And now we have significant uptake of telehealth, whereas before it's more lesser than. Right now we're seeing that it might be a more accessible format for providing supports for families. And that could be done with schools help as well, especially in hard to reach communities. The Express Care app that the state recently put out is also a good example of an amazing thing that's coming out of this crisis. So I hope to look at all of the things that have happened during this time and really evaluate what are our priorities and how do we ensure that in a storm like this, we can all...
I like it. Dr. Culberson.
Feelings follow behavior. And so if we take action and we do things that we can do in our own networks and our own homes, then that's going to help us weather the storm. We're going through a shared community trauma. And it's really important, as Andrea said, to ask for help, to be able to reach out and connect with other people. And I think most importantly, we need to be kind to ourselves. We need to be kind to other people. We don't know the difficulties people are facing and that they faced before. And when you think of people who are living on the edge or really struggling, then this community trauma has just added to that weight. And we need to have compassion for ourselves and for other people. And remember that we're really all in this together, and there are opportunities and there are blessings that come with hard times. So I think that's really important to remember. This too shall pass.
Wise words. Dr. Benson, can you give us our final thoughts?
Sure. The most critical thing that we can do to promote resilience and mental health is to avoid exposing children to additional traumas. Yes, COVID has happened to us, but we have an ability to keep it from defining this generation's mental health. In the wake of the coming economic downturn, it is crucial that we take steps to mitigate its negative impact on the safety and security to children. Practically, this means that we protect and bolster resources that address issues of housing insecurity and food insecurity. Without doing so, there will be generational impacts of this crisis that we could have very well prevented.
Thank you all so very much for sharing your wisdom and your knowledge and your kindness. We appreciate your efforts today. And for everyone out there, please stay healthy, stay connected, and reach out. Many resources are available whenever you or your family needs a helping hand. These resources include the Georgia Crisis and Access Line, GCAL at 1-800-715-4225 for immediate access to routine or crisis service, or use the app My GCAL to text or chat. Download the Express Care app for virtual COVID-19 screening and testing. Visit augustaexpresscare.org to learn more. Support groups are operating virtually around the state through NAMI Georgia, NAMIGA.org, also through the Mental Health America of Georgia, MHAGeorgia.org, and the Georgia Parent Support Network, GPSN.org. Get connected. Any information can also be obtained at the Resilient Georgia website, resilientgeorgia.org. Thank you all for your attention.